Hi there, I'm Dr. Guy Carnazza, and I practice in the town of East Rockaway, New York. And today I'd like to welcome you to discover what's possible. Today I have a treat for you. I'd like to share with you a case that we recently completed of a 47-year-old female patient who came to us asking for us to fix her smile. She presented with missing all of her lower teeth and wearing a full lower denture, and missing some of her upper teeth wearing a removable partial denture. And what we did was we restored her entire upper and lower jaw with dental implants, and we were able to retain some of her natural teeth. So let's get into it and show you how we did this. So when the patient came, she told me she did not want to wear anything removable anymore. She was tired of removable teeth. She told me she had lost all her lower teeth a few years back, and she was very unhappy with the denture and didn't want to wear anything else removable. And she also let us know that she was grinding her teeth. So on further examination, we were able to see, yes, she was grinding her teeth because she was fracturing all the porcelain off of her existing crowns. Her upper jaw was composed of 7 remaining natural teeth, all hadn't been crowned. And the lower jaw, again, a full lower denture. So the only way we can get full fixed teeth, non-removable teeth, was to consider dental implants. So what we did was we sent the patient for what we call a CT scan. And this CT scan is a 3-dimensional rendering of the upper and lower jaw that lets us see both the jawbone in width and height, so we can then assess the available volume of bone to place dental implants. And after examining and reviewing the CT scan in our software, we use something called Simplant. We were able to determine that only 2 natural teeth were healthy enough to remain in the upper jaw, and we could place 5 implants in the upper jaw. And the only available volume of bone was in the lower anterior of the lower jaw, which we were able to place 4 implants. And when I explained this to the patient, I told her that we weren't going to be able to give her very much or very many posterior teeth on the lower jaw because she didn't have enough support for a fixed bridge with only 4 dental implants. If we were able to place more implants, we were able to put some posterior molar teeth. But because we weren't able to do that, I had to let her know that the final bridge would be restricted to what we call the premolar teeth. And she was comfortable with that because she didn't want to wear anything removable. So, again, using our CT scan to plan the placement of the implants, um, it allows us to see the volume of bone in 3 dimensions to place the implants properly. And that's basically what we did. So we placed 5 on the top and 4 on the bottom. And here, as you can see, we have the patient in her new temporary teeth, which are fixed. And we kept her in these temps for a period of 6 months because we were altering her bite, changing her bite, and she hadn't had fixed teeth for such a long time, at least on the lower jaw, and then a full complement of fixed teeth on the upper jaw. We put her through a testing phase with the temporaries, just to see how she adapted and how she functioned with them. And she did very well. So after a period of 6 months, we then went ahead and restored the upper and lower jaw. So in the lower jaw, we placed a screw-retained porcelain to gold bridge on the 4 lower implants. And on the upper jaw, we placed a cement-retained porcelain to gold bridge. And as you can see in some of these other views, we were able to replace and replicate the lost soft tissue on the upper left side with pink porcelain. So the patient didn't have to go through any extensive what we call gum grafting. And this allowed us to keep a nice proportional balance of her smile. And we kept the teeth rather flat because we knew she was going to continue to grind and wear away. So we actually even have her in night guards to protect the new porcelain of the finished bridge work. And then these are just some side views of her bite. And you can see again the pink porcelain, which allowed us to replicate the lost tissues there and allow us to keep some nice proportional balance. So, with the use of dental implants, we were able to restore this patient's upper and lower jaw, rehabilitate her bite, give her a quality of life that she hadn't had, and she was very, very happy. The outcome was excellent. The aesthetics and the function all met the criteria of what we were looking for. This process took us about a year because the patient got sick in the process, but was well worth it in the end. So, that's Discover What's Possible. If you're interested in learning more about dental implants or full mouth rehabilitation, you can call us at 516-887-3550. We're in the town of East Rockaway, only 20 minutes from JFK International Airport. And you can learn more about our cases and see more before and afters on our website at carnazzadental.com. I'd like to say thank you, and we'll talk to you soon.